There is a small gland inside the male body that most men never think about until the night it wakes them up for the third time. Why does something the size of a walnut have this much power over sleep, over confidence, over something as basic as walking to the bathroom without bracing for pain? Why do so many men in their 40s start noticing changes they can't quite explain? And why does almost nobody talk about it until it's already a problem? That question is where this story begins. And by the end, you'll understand something about your own body that most people go their whole lives without knowing. Let's start a strange fact. The organ we're talking about, the prostate, isn't something doctors even mention until something goes wrong with it. It doesn't get the attention the heart gets, or the brain, or even the knees. Yet it sits at one of the busiest intersections in the entire male anatomy, a place where the urinary system and the reproductive system physically cross paths. Nerves pass through this region. Blood vessels pass through this region. Muscles that control both bladder function and sexual response all converge here. And because of that crowded intersection, when the prostate changes size or shape, the effects don't stay contained to one system. They spill into both. Here's where it's interesting. Most people assume the prostate is just part of the reproductive system, something related only to fertility. But its real job is closer to that of a gatekeeper. It produces a fluid that protects and nourishes sperm, yes, but its location does something else entirely. It wraps around the urethra, the tube that carries urine out of the body, almost like a donut wrapped around a straw. When that donut is a normal size, urine flows freely and nerve signals travel unobstructed. But when that donut begins to thicken, and for a huge percentage of men it eventually does, the straw at its center starts to narrow. This is the part almost nobody explains clearly, so let's slow down here. As men age, hormonal shifts, especially subtle changes in testosterone and estrogen balance, along with cellular changes in prostate tissue, often lead to a gradual enlargement of the gland. Doctors call this benign prostatic hyperplasia, or BPH. Benign simply means it isn't cancer, but that word can be misleading, because benign doesn't mean harmless. As the gland grows, it can squeeze the urethra like a fist tightening around a garden hose. Urine that should exit quickly and completely starts backing up. That's why so many men in their 40s, 50s, and beyond suddenly find themselves waking up 2 or 3 times a night, standing at the toilet for what feels like forever, or feeling like they never fully empty their bladder no matter how long they wait. But here's the twist most people never connect. This same swelling doesn't just affect urination. It also puts pressure on delicate nerve bundles running along both sides of the prostate, nerves that are essential for normal erectile function. Think of it like a busy highway interchange. If construction narrows one lane, it doesn't just slow that lane down, it creates a ripple effect through the whole system. That's exactly what happens when the prostate enlarges. Reduced blood flow, compressed signaling, and for a lot of men, this shows up first as a subtle change in performance long before anyone thinks to connect it to the prostate at all. Research published in urology journals has repeatedly shown a strong correlation between lower urinary tract symptoms and erectile difficulties, suggesting these two issues often share the same root cause rather than being separate problems. This is the part that surprises most people. Erectile changes are frequently treated as a standalone issue, something people assume is purely psychological, purely about stress, or purely about aging in a vague, unavoidable way. But for a significant number of men, the real story is mechanical. It's about space, pressure, and blood flow, not confidence or willpower. Understanding that distinction matters, because it reframes the entire conversation. This isn't a story about failure. It's a story about anatomy doing exactly what anatomy does when a gland grows in a crowded space. So why does this happen to some men more than others? Genetics plays a real role. Family history of BPH does increase risk. But lifestyle factors matter more than most people realize. Chronic inflammation, often driven by diets high in processed foods and low in fiber, has been associated with prostate tissue changes over time. Sedentary lifestyles reduce blood circulation throughout the pelvic region, and poor circulation anywhere in the body tends to affect the areas most dependent on consistent blood flow, which includes both bladder function and erectile tissue. Chronic stress elevates cortisol, which can disrupt hormonal balance in ways that indirectly affect prostate health. None of these factors act alone. They compound quietly, year after year, which is exactly why prostate changes often feel sudden even though the underlying process has been building for a decade or more. There's also a psychological layer to this that rarely gets discussed. Many men delay seeing a doctor about urinary symptoms because the topic feels embarrassing, or because they assume it's simply a normal, unavoidable part of aging that nothing can be done about. That hesitation matters. The earlier a change in prostate health is understood, the more options exist for managing it, and the more likely someone is to prevent it from progressing into a more disruptive condition. Avoidance driven by embarrassment is, in a strange way, one of the most common risk factors of all, not because it changes the biology, but because it changes the timeline of when someone finally gets informed. Let's talk about what a healthy prostate actually depends on, because this is where the story shifts from problem to possibility. Hydration matters more than most people expect. Chronic mild dehydration concentrates urine and increases irritation to the bladder and surrounding tissue, which can worsen urinary symptoms even when the prostate itself hasn't changed much. Diet plays a defined role as well. Diets rich in lycopene, found in cooked tomatoes, along with zinc, foods like pumpkin seeds, and omega-3 fatty acids found in fish like salmon, have been studied for their association with better prostate tissue health, likely due to their anti-inflammatory properties. On the other hand, diets high in red meat and dairy have shown associations with increased prostate-related symptoms in several population studies, though researchers are still working to fully understand the underlying mechanisms. Movement is another underappreciated piece of this puzzle. Regular physical activity, especially activities that engage the lower body like walking, cycling in moderation, and strength training, support healthy circulation to the pelvic region. This circulation isn't just about heart health in the traditional sense, it's about making sure that oxygen and nutrients reach tissue that depends on it for proper function, including the tissue responsible for erectile response. Pelvic floor engagement, the same muscles used to stop the flow of urine midstream, also plays a supporting role. These muscles help control bladder function and contribute to blood flow regulation in the region, and like any muscle group, they can weaken with age and inactivity or strengthen with consistent, appropriate use. Sleep, oddly enough, is another factor most people never connect to prostate health. Poor sleep disrupts hormone regulation throughout the body, including testosterone production, which follows a natural rhythm tied closely to deep sleep cycles. Men who consistently sleep poorly often show altered hormone patterns that can influence both prostate tissue behavior and sexual health over time. It's a reminder that the body doesn't operate in isolated systems. What happens in the brain at 3 in the morning can quietly influence what happens in the pelvis years later. Now, here's something that deserves an honest, balanced explanation, because the internet is full of confident claims that don't hold up to scrutiny. For decades, some practitioners have explored external pelvic and perineal massage techniques as a way to potentially support prostate-related symptoms and pelvic floor relaxation. The idea behind these techniques is that gentle stimulation in the region between the base of the scrotum and the anus, an area closely associated with the underlying prostate tissue, may help with circulation and muscular tension. Some small and older studies have explored massage-based approaches for certain prostate conditions, particularly chronic prostatitis, with mixed and limited results. However, the scientific evidence supporting external self-massage techniques, including using firm objects like a tennis ball while seated, remains thin, poorly controlled, and far from conclusive. It's also worth being honest that applying concentrated pressure repeatedly to this specific area carries a real risk of nerve irritation, since the pudendal nerve runs directly through this region and is sensitive to sustained compression. This is not a scare tactic, it's simply an accurate picture of an area of health where enthusiasm has, at times, outpaced evidence. If pelvic floor or prostate symptoms are something you're experiencing, a conversation with a doctor or a pelvic floor specialist is a far more reliable next step than adopting a DIY technique built on anecdote rather than data. This is really of the story, isn't it? Not a single trick, not a single object, not a single dramatic fix, but a body that responds to years of accumulated habits, decisions, and quiet neglect or quiet care. The prostate doesn't announce itself the way a headache does. It changes slowly, silently, in the background, until one day it becomes impossible to ignore. And by the time it becomes impossible to ignore, the story has usually been writing itself for a very long time. So what does meaningful prostate care actually look like, stripped of hype and shortcuts? It looks like regular checkups, particularly after age 40 or 50, depending on family history, where a doctor can track changes over time rather than reacting to a crisis. It looks like understanding that a PSA test, while not perfect, gives useful information when interpreted alongside symptoms and a doctor's clinical judgment, not as a standalone verdict. It looks like eating in a way that reduces chronic inflammation, moving consistently rather than intensely, sleeping in a way that respects the body's hormonal rhythms, and being honest with a healthcare provider about symptoms instead of quietly hoping they go away. There's something almost poetic about how interconnected the body really is. A gland the size of a walnut, tucked away in a place most men never think about, sits at the crossroads of two of the most fundamental functions of daily life: the ability to relieve yourself without discomfort, and the ability to feel confident and connected in intimate moments. It's easy to treat these as separate conversations, one clinical and one personal, but they were never actually separate at all. They were always the same conversation, just told from two different rooms in the same house. Maybe the real takeaway here isn't a single tip or a single technique. Maybe it's a shift in how we think about the parts of our bodies we've been taught to ignore until they fail us. The prostate isn't a mysterious, unknowable thing. It's a gland that responds, like almost everything else in the body, to the ordinary decisions made day after day: the food, the movement, the sleep, the willingness to ask a doctor an uncomfortable question a little earlier rather than a lot later. And maybe that's the most useful thing to carry away from this. Not fear, not urgency, just a quieter kind of attention to a part of the body that's been quietly asking for it all along.